And we're back with Legends of Lake Howell. This month our guest is none other than Brett Chance. Thanks for joining us.
Yeah, man, absolutely. Thanks for having me.
All right, so today we're here at your business, so tell us what you do exactly.
Yeah, so I'm a chiropractor by trade. I'm a chiropractic sports physician, the owner and clinic director here at Winter Park Chiro. Yeah. We offer kind of that whole body approach to patient care, not only from the chiropractic side, which we're not just hitting, let's say, the spinal column, right? We're getting a little bit of everything. So we're dealing with knee pain, shoulders, hips. Once again, that full body approach. So not only on the chiropractic side, but then we hit it hard with the corrective exercise and the rehabilitation. Whether it's focusing on more of the prehab side of things and helping people even before surgery, or even hitting it hard post-surgical status as far as rehab. And then we also have another wellness branch on the back end of the chiropractic side, is more of the advancement in like functional medicine. We look at different biomarkers as far as genetic testing goes when it comes to diving into blood work. Hormone optimization, peptide therapy, some of the latest things that you're kind of seeing right now in the field of functional medicine.
So it's interesting that you say that, because oftentimes when you mention like you going to the chiropractor, you think the spine. Yeah. But it seems like there's a lot more involved with what you do.
Yeah, absolutely. We treat the whole person, right? So from a neuromuscular skeletal standpoint, we treat the nervous system, we treat the muscular system, and we treat obviously the skeletal column, or all the bones essentially. But I'm very dynamic in what I do. Just in here, we are pretty unique as far as how we treat people. Our new patient exams are very in depth, and yeah, we're just not dealing with strict injuries. The majority of our patients are actually wellness patients, which is actually pretty neat. Of course, we'll see those traumatic injuries, and we're going to help kind of triage anything that we can. But majority of our patients are wellness, so they're looking for that that either that little extra boost of performance, that a little extra boost of recovery, or just anything to really just help optimize on the back end.
So what brought you into this line of work?
Oh man, this is going to be a long one here. Okay. All right, so at Lake Howell, man, I was part of that great run. We won a state championship in '07 playing basketball. Had a Division I scholarship to go up and play at Canisius University up in Buffalo. My freshman year, got injured and actually tore my labrum in my left hip. So I ended up transferring back home and finished up my career playing at Rollins. So during that time, though, kind of skip forward, I had 5 hip surgeries. I ended up blowing out both of my knees during my time in my playing career. I've had every therapy possible known to man done, man. I've had PRP, stem cells, anything in the regenerative side to just try to help, get me back on the court as fast as possible, but just plagued by injuries. So, long story short, just living out my career essentially in athletic training rooms and dealing with all the trainers, medical staff. That's kind of really where I found a passion for all this stuff. And, I'm very thankful to be where I'm at right now.
So this is a passion for you. This was not something that you started out in, say, elementary or middle school saying, hey, I want to be a chiropractor. This was just something from your experiences that you said, man, this is a field that I would like to know more about.
Yeah, absolutely. And once again, going through all of my injuries and everything, I found a really good chiro who, specialized more on that sports medicine side. So I got a whole different feel for it. So, I was getting adjustments and I always felt good, but I just didn't know what was this guy doing, what were they doing? I was getting all sorts of soft tissue work done, but I always felt good. I felt like I was recovering and I was still able to, maintain my career and kind of play through. But yeah, it kind of fascinated me with the entire approach to it. I got into the strength and conditioning side of things for a while and actually linked up with another Lake Howell legend, Kawika Mitchell, for a while. So he's a good friend and mentor of mine. I got to work with him after undergrad, and that once again really set my passion to go ahead and move forward and get my doctorate.
So what are some of the common injuries that you see, the most common injuries that you often see here?
For me, I treat a lot of shoulders, knees, and hips. And once again, I really didn't reference the spine, So for me, once again, I'm very unique. I hold 2 different board certifications, not only in chiropractic medicine, but also in physiotherapy as well. And I am a sports certified chiropractor, so not a lot of people have that distinguishment. I've just worked my tail off to just be the best in what we do here as far as treating musculoskeletal in the entire body. So, but those are my primary complaints that I really see here in the office, which is once again pretty unique because I did not even mention the spine.
So you mentioned wellness. So how does that, as opposed to like injuries, what does that mean exactly with wellness?
Yeah, just maintaining. So I think everybody kind of has those natural aches and pains, right, that you're trying to deal with. If people are sitting at a desk all day, right, that's a repetitive seated motion, shoulders rounding forward. So kind of what we do complementary to that is, hey, we're going to do maybe some soft tissue work. We'll do some postural adjustments with you to just try to maintain. And then on the back end too, we utilize a lot of different technology. So our patients are well equipped with education. Right, so they have at-home exercises that they're doing. They have mobility work. So some really quick hitters that they can do throughout the day that doesn't break the bank on time, right? Because that's the number one thing we hear. Oh, I don't have time to do all this stuff. Yes, you do. It's just being really strategic and breaking it down for someone. So that's more that wellness side.
So if I'm a new patient and I'm coming in, what does that initial visit look like?
Yeah, so that initial visit, we're going to spend about an hour together. We're going to really dive into everything, your full medical history, any old injuries. If you have any special imaging as well, MRI, CTs, anything along those lines, we'll go ahead and review those too. And then I'll take you into the back room here, and we kind of spoke briefly before, we go through a whole mechanical screen. So essentially I'll take out the iPad and I'll have you do some kind of functional movements, and we'll basically videotape that and we'll go through that together. Call it watching game film. So we make it fun, but you want to have that objective data for somebody to see going through their movements. So if it's somebody very active, it's somebody like you, I'm going to take you through a full assessment. So body weight squat, maybe some lunges to look at pelvic stability here and how it relates to the knee and to the ankle, and then also look at some shoulder mobility to see how it promotes into the upper back, into the spine. Yep, exactly. Good posture, right? And then just depending on kind of what's going on, obviously we dive into your goals and everything. And then, we kind of set a game plan. We're not here really, we'll basically set a game plan on that. And once again, we're here to really just, try to hit those goals at the end of the day.
So I noticed that not only do you work with adults, but you have like a pediatrics section as well. Tell me about the pediatrics part.
Yeah, so we have a specific chiropractor in here who's actually Webster certified, so pre and postnatal, and then also pediatrics. Okay. So she'll dive into all that stuff. She's really the expert in that. I'll typically get the pediatric patients around maybe 10, 11 years old when they're starting to get a little bit more into that youth sports transition. So once again, that really goes into the biomechanics of the body and diving into that with them. So, we really want to clean it up fast with those guys, just because, they're like sponges. So if we can really just make some quick adjustments for them to help reduce injury or some injury risk, we'll go ahead and just make some quick hitters on that.
So especially with the younger kids, their bodies are still growing and developing. So like how involved do you get with that? Or is that, I guess for a better way to say it, like you don't want to do too much because they're still developing, and how do you help support that?
Yeah, exactly. And and I'm sure you've seen it too. These kids are specializing at such a young age now. Right. They're training day in and day out. Everybody has their own trainer. Everybody has their own skill work person that they're utilizing. So really, we have a little bit of a fun program. We call it the fundamentals, right? So, just to answer your question, where somebody, a younger pediatric patient is still developing and trying to get that coordinated effect, we're doing a lot of body weight movements, but really emphasizing tempo. All right, so whether, I think a squat is just a pretty easy example for that. So if we're utilizing tempo, we'll just make sure 5, 4, 3, 2, 1, 5, 4, 3, 2, 1 to just elicit a little bit of a better coordinated movement response on that. So strengthening up the tendons and ligaments, which are very helpful for reducing injury risk, especially at such a young age.
So do you think that, you're familiar with a lot of youth sports, do you think that a lot of our students, kids get involved with sports, or a little too intense with sports very early on or too early on?
I think that's kind of a loaded question, right? I know for myself, growing up, I was doing everything. I was training day in and day out. I was at Redbug Park every single day, right? Front courts, back courts. All of you guys who hopefully are watching this, you know what I'm talking about. But yeah, I think we all kind of go through that. I think there is a time where, we need to recover, of course, and even the young ones do need to recover. So if we can optimize that on the back end, focus on nutrition, focus on hydration status, and understanding, there's a lot of natural supplementations out there too that even, our youth athletes can take that is 100% recommended and obviously safe and natural.
You mentioned recovery. How important is recovery and just giving your body a chance to rest? How important is that?
Oh, it's extremely important. That's where the resting aspect is where we really repair and grow. Not only from, our cell site position and the physiology of the body, but also, man, it really helps create a nice balance for the brain. So, we got to get sleep. Sleep is the easiest thing we can do. Sleep is free, okay? Make sure you're getting sleep. All right, but recovery is absolutely important. So you can hit it hard those 5-6 days a week, but if you're not recovering, you're not going to make you're not going to make those gains that you want.
So in addition to Winter Park Chiro, you also have something else that you do, the bodybuilding.
I do, yes.
All right, tell me about that.
Oh man. So, I guess, being an athlete my whole life, I really like that push and that dedication for that. I'm a very regimented person anyways. I wake up at the same time every day. I weigh out all my meals. It's just kind of how I am. You can ask all these guys in here. And I've been like that pretty much since day one. But yeah, I got into it about 2 years ago and had a lot of fun doing it. My first show, I actually won my division. First show I was actually nationally qualified. Which was pretty amazing in the men's physique division. So, really focuses on symmetry aspect of things and muscle fullness, which is good. I'm not the biggest guy ever on stage, but I get very, very tight conditioning. So, that will typically kind of push me through at least into the finals. But, it is definitely a grind, but it's something that is really fun. And it just, once again, it just kind of stirs that passion up for the athletic performance side that I'm so used to.
So what does a day look like? You mentioned you were very regimented. What does a day look like? And we'll talk about like what you eat as well.
Yeah.
For someone that's a bodybuilder.
Yeah. So yeah, well, first of all, I have a family, right? I have a family, I have a full-time business. I work all day, right? Yeah. So I'll go home after a long day in here around maybe 6:30, eat dinner, put my daughter to bed, and then I'm pretty much sleeping by around 9:30. Wake up calls about 4:30, 5 a.m. First meal is in, about 60 grams of protein, about 100 grams of carbs, little fat during that, and then digest, and then into the gym. So into the gym for about 2 hours. And that's doing my full workout and my cardio to just get it out of the way, and then I'm back in here all day. So if you peek around the corner here, I got a bunch of rice cakes, egg whites, protein shakes galore, but once again, that's kind of all throughout the day. Rice, ground turkey, and then it's just on repeat,
Do you have a cheat day? Is it a cheat snack, that something that you eat like, man, I worked really hard, I deserve this snack? Is it something that you...
So
there's no cheat days, it's all work and business.
Well, right now there is no cheat days, unfortunately, but if I do a cheat, it's going to be like sushi. And even sushi is not going to be too bad. Okay. I'm not getting all the mayo or anything on. I'll keep it pretty lean. But that's kind of my cheat day if I'm going to do anything is sushi.
So is there a different level of training that you have, like when you're preparing for competition, as opposed to you're just working out just to stay in shape?
Yeah, absolutely. So right now, I'm about 8 weeks out from a show. Okay. So my cardio is bumping up. My calories and my macros are dropping down a little bit. So I'm trying to really titrate up and down on some different things. So yeah, I mean, it's a whole different ball game once you start going into prep, because the whole point is to make sure that you're losing body fat and you're not losing a lot of lean muscle tissue that you worked so hard for in the off season to maintain. So that's always the big juggling point. Yeah.
So let's talk a little bit about your experience at Lake Howell. You mentioned that you played on the basketball team.
I did. Yep. So
did you do any other extracurricular activities?
I played volleyball for a couple years there as well. I think my sophomore year, I might be dating this one. I think my sophomore year we ended up going to the state finals as well for volleyball, so that was pretty good. We were pretty stacked that year. But no, man, it was just basketball and volleyball and kind of the off season for me. I knew what my goal was to get a college scholarship for basketball, so that's all I did. I trained, and yeah, we just tried to take it to the next level.
So if you could describe your experience at Lake Howell, one word or a couple of words, what would that be?
Oh wait, don't hate. That's it. Mic drop.
Who so I'm sure that Coach Cone had a profound impact on
Yeah.
on you. Was there anyone else at school that?
Cindy Frank. Cindy Frank. That's kind of what sparked really, and I see her here and there still to this day. So amazing. That's kind of really what sparked my interest into science and biology, and even into the chemistry side of things. You know, I think in high school all that stuff is kind of frightening. You know, chemistry and looking at all these molecules and trying to figure out all this stuff. And you know, she really took time with me and helped. I used to stay after with her, and you know, I think that's once again, you know, anytime I revert into like a Lake Howell thought process as far as education goes, I always, you know, go back to, you know, Miss Frank. She was awesome for me.
What advice would you give for students who are looking to go into just the medical profession, not specifically being a chiropractor, but just in general?
Yeah. You know, I think in the medical profession, you definitely have to have, you know, a deep passion for it and a deep passion for actually trying to want to help people. You know, this day and age where health and wellness is so critical, you know, that passion really has to be there. So that's really, I would say, the number one thing is have passion for what you want to do, whether it's in healthcare or anything else. I think that will, you know, that'll create a lot of enjoyment for that person in life, and just being able to sleep well at night.
All right, so last question that we have here is, we've got a young Brett Chance, 9th grade,
Oh,
and
man.
you had an opportunity to give him some advice. What would you say to him?
Oh man, okay, all right. See, I knew this question was going to come up too. They prepped me and I still have no idea. No, it was...
Well, you just had such an interesting pathway to your job.
For sure.
And you had some injuries, and you've turned something that could have been a very negative experience into something positive.
For sure. I would just say, you know, keep your head down and just keep working. You know, when, you know, there's a lot of things that are thrown at you in life. You know, some of it are, you know, out of your control, but, you know, those things that you can control, make sure you own it and do what you can. But, yeah, just persevere.
And again, thanks to Mr. Chance here for taking the time to visit with us. And as always, go Silverhawks.
Go Silverhawks.